Hello teacher, this is Wendy. I'm gonna do a risk factor of warfarin. As we all know, warfarin is a very dangerous drug that used to break down a blood clot, and it's prevent from forming larger. This medication can cause several complications in the body. The numerous risk factors of warfarin can cause an increase of probability of having a hemorrhage, skin necrosis, and kidney damage. Warfarin medication increase bleeding, so patients who are going under surgery or dental work and medical procedure, warfarin must withdraw. Skin necrosis can be induced by a treatment of warfarin due to blood clots or cause disruption in the blood supply. This can result as necrosis. The development of skin necrosis can be erythema, partial hemorrhage, red, purple, and black discoloration, necrosis, and hemorrhage blister. As we recognize an early sign of necrosis, we can prevent patients from substantial morbidity associated with warfarin. The main risk of warfarin is bleeding. According to the article of PMC, the incident rate of hemorrhages stroke after this starting warfarin was 294.6 cases per 10,000 person years. Risk of hemorrhages stroke. There are reports of a study group consisting of 65 patients on warfarin use who have been admitted to emergency service for major and minor bleeding episode. 4 patients are on warfarin with the certain condition associated with aging, increased risk of bleeding. Elderly patients usually require smaller amount of warfarin to achieve desired anticoagulant effects. There are a lot of elderly patients on multiple medication that can interfere with warfarin as well. Patients who are older than 80 years old have a higher chance of intracranial hemorrhage when they are on warfarin. Patients with kidney and liver insufficiency, severe to moderate, that are on warfarin, the side effects of this medication can cause renal failure or renal damage. According to National Library of Medication, have found that warfarin causes renal damage in patients that have chronic kidney disease, also associated with progression of renal disease. Negative effects on vascular health. It can risk for people having congestive cardiac failure and electric instability in their heart, leading to sudden death, cardiac death, and the main cause of cardiac vascular death in hemodialysis patients. As warfarin is a very dangerous drug, it must be conscious when it's used with another drug, such as aspirin. Aspirin is used for bleeding, reduce the blood clots as well, and it's also used as a fever and pain relief. This can increase on GI bleeding, ulceration, and perforation. So as we research this medication, we know that warfarin can use as a advantage to our body to break down the blood clots, which allows patients with myocardic infarction just to prevent stroke. On the other hand, side effects of warfarin can be very dangerous drug. It can cause life-threatening. It's considered as a Schedule A drug class. It's a legislative control. This presentation, me and Strategy, we understand how warfarin work and how to use warfarin appropriately. And we understand the quality and the danger of this medication. Thank you for participation for our presentation. And if you have any question, please email us, Strategy or me. Thank you.